Recording?
Yep.
Perfect. Perfect. Okay, welcome to the Love and Thunder podcast, everyone. Today I have a renowned physician who specializes in cutting edge regenerative medicine, Dr. Vassily Eliopoulos. I'm
You got
not sure.
Eliopoulos. Dr.
Eliopoulos. Dr.
Doc-
Voss, I know.
or
I always
Voss.
call you Dr. Voss, and I was like, I need to say his whole name. So nice to have you here, Dr. Voss. I mean, how long have we known each other at this point?
Yeah, it's been years. Can't
It's kind of
remember
crazy.
how many years. It's been many years.
Yeah,
Yeah.
yeah. I mean, we came to you in 2020 when it felt like our body were falling apart during
That's right. And
COVID.
it was masks and the whole
Mhm.
baby, right? Oh my goodness. And now she's like this amazing, active person. Yeah.
Yeah, it's just
Yeah.
beautiful, so healthy and everything. But yeah, we met you back then through kind of like learning about stem cell, which is what I think you specialize in. Do you
Yeah.
want to, yeah,
Yeah.
do you want to give us a rundown of like what that even is? Because I think
Yeah. Sure.
like even myself, I have an idea of what it is just from working with you,
Sure.
but it's such a like wide array of
Yeah.
like,
Yeah.
yeah.
Yeah. It's a great place to start. And I guess first off, just thanks for having me. I really
Oh,
appreciate it.
yes.
I'm very grateful. Yeah, so yeah, I was looking forward to this. So thanks.
Oh, well, the feeling
Uh,
is mutual.
yeah. So stem cells, I think there's the thing that gets confusing for people is one, stem cells really isn't the right name. It's actually a stem cell therapy, but it's the name that's been popularized both in the field in regenerative medicine among doctors and for the people who are looking for these therapies. They know it as stem cell therapy. The reality is stem cell therapy refers to a whole group of therapies, and the analogy I use, it's like saying surgery, right? Like there's all kind of different types of surgeries, different ways to do it, laparoscopic, open, different organs. It's this wide field of medicine. People specialize in different parts of it. And stem cells are similar to that. There are many different therapies that fall into the label of stem cell therapy. And they each have sort of a different utilization and a different strength and can be applied in different ways. And so I think it gets confusing for people because they think it's one thing because that it's one name, right? Stem cell therapy is a name, it's like saying medication. But within that class of therapies, there's this wide variety of different therapies, and it gets confusing because they're like, well, I've heard you got to go to Panama or you got to go abroad to get that done, or you can't get it done here, or I've had bone marrow done, or is PRP stem cell therapy, like is A2. So there's this, the first thing is stem cell therapy is a wide range of therapies, and there are different strengths and weaknesses to each of those therapies depending on what the therapy is and what you're trying to treat. And so there's no one therapy that is stem cell therapy, I think, is the first point I make.
Yeah, that's so, just that is so helpful because like you say, even on my side, like what you hear on like a blog or a podcast or whatever, it's like, okay, well, Joe Rogan said go to
Right.
Panama and get
Yep.
that, and then this
Yep.
other guy says that, and it's like, well, yeah, like what applies to what?
I was going to say, hey, Dave, I don't want to interrupt the flow, but yeah.
Yeah, that's the flow. That's exactly what's happening there. Let's go. I mean, could
So,
you tell me like maybe like those
yeah,
branch
so,
and like what would they
yeah,
apply to?
yeah. So I can, to try to break it down a step further, it's, cell therapy or stem cell therapy is using a naturally occurring cell, either your own or somebody else's cell, that what it naturally does in the body is to help heal tissue. And so there's a variety of different cells that are involved in the tissue healing process. And all of the stem cell therapies in some way, shape, or form involve collecting that cell, concentrating it in a variety, there's a variety of different ways, and then deploying that or using that in the patient to help activate healing or concentrate healing wherever you apply those cells. And so from a broad construct, stem cell therapy is harvesting a cell that's naturally involved in healing, concentrating it, and then using it and applying it where you're trying to initiate enhanced healing. And so there are many different types of stem cells that are used. And then I'd say there are some therapies that I don't consider stem cell therapy that some people refer to or market as a stem cell therapy. And the first example of that, or a great example of that, is PRP. So PRP is where you're harvesting or drawing blood to get the platelets, and you concentrate the platelets. The reason why we want platelets is that platelets are loaded with growth factors and proteins, because what platelets do naturally is when you get an injury, and I use like a finger cut is sort of the best simple example. You cut your finger, the first thing that happens is, well, it hurts, but it bleeds. And then the next thing the body does is it needs to clot that bleeding. And the platelets are important in that process. So the platelets aggregate and create a clot. And then what the body does is it initiates a healing response, which is acute inflammation. And the platelets trigger that by releasing all of the proteins and these growth factors that they contain within them to initiate that healing process, to initiate the acute inflammation. And then there's a much more complicated sort of healing process from there. There's acute healing and chronic healing, or acute inflammation and chronic inflammation. But in short, like PRP is sometimes sold as a stem cell therapy or marketed as a stem cell therapy. In my mind, I don't think of it as a stem cell therapy. It's a cell therapy, but it works the same way all these therapies work. You're harvesting platelets, you're concentrating them, and then you're putting them where you want enhanced healing. So that's one example. I think a more common example, so I'll go into three just to kind of make it simple.
Yes, I love it.
The first one is what most people get when they do stem cell therapy here in the United States, which is a bone marrow aspiration. So what you do is you access the bone marrow, which is, it's a minimally invasive procedure, but there's some invasiveness associated with that. You numb up the area. It can be done under local. Sometimes people need to be sedated because accessing the bone, it's usually involves a hammer, and you kind of have to push through the cortex of the bone to get into the bone marrow. And then there is inside the bone marrow a variety of different cells, and we're interested in the mesenchymal stromal cell, or what was initially called the mesenchymal stem cell, because those cells that exist in the bone marrow, they exist in multiple other tissues of the body too. But the cell that you're trying to get and concentrate from the bone marrow is that mesenchymal stromal cell. And so you access the bone marrow, you draw a bunch of bone marrow into a syringe, you then process that tissue to concentrate the MSCs, or the mesenchymal stromal cell. And then you inject those mesenchymal stromal cells into the area where there's an injury to accelerate healing.
So who would that first thing kind of be for? Because, it's like, I know you, and like, I know for me, if you told me you need this, I would be like, yes, no problem, sir. Yeah. But I think when you talk to the general population, you're like, oh my God, going in my bone, like, so like, what would be like the place to that, and like how invasive or not is that? Yeah. So I'm, I'll just say up front, I'm biased on this, and I'm biased from my experience, but also from the data that exists on this. Bone marrow is a good therapy for young, healthy people, meaning in their 20s or early 30s. Really? That's my opinion. There are other people who do these therapies in people much later, but there's an important reason for why that is. There's a reason why this is the main therapy done in the United States, and that's because the FDA and the guidance that they have put out on cell therapies
have selected, they said bone marrow and this type of therapy that I'm describing is okay in their eyes, and other types of therapies that access the same type of cell but present in other tissues of the body, they feel is not okay to be done. And now this is what confuses a lot of people, because if the FDA has said, we want you doing this, we want you doing bone marrow, and we don't want you doing these other ways of accessing these cells, they think that it's not available here in the United States. But the reality is that is actually currently being litigated, and we could go into this sort of. It's in my opinion, and in the opinion of many people I know in the space, the FDA has made an arbitrary sort of classification, which has shifted the rule set around autotransplantation. Because I don't want to get too technical, but really, what are we doing when you draw PRP? When you draw platelets and you concentrate them and you give them back, the medical term, that's an autotransplantation. I'm taking cells from you to give back to you. So it's a self-transplantation. We're drawing a cell from you from the circulation and putting it either in a joint or a ligament. So we're just simply transplanting that tissue from one place to another in your body. Now, there's a whole set of rules that have been in place for many decades, because autotransplantation is something we do on a daily basis in the medical field. So great examples like skin grafting, common examples that people are aware of, like bypass grafting for, heart blockages. You're pulling a vein in the leg or the arm and transplanting it for a blocked artery in the heart to help, you're basically use that vein to bypass the block, and so the flow can get past the blockage in that artery. That's autotransplantation. You're taking a vein and splicing it into an artery. Now, those tissues, like an artery and a vein, are different. They're similar, but they're different, right? But they can, you can make a vein work as an artery. And so,
that's crazy.
This is what we're doing. And the same, another great example that people are familiar with is like ACL replacement, because the ACL is a ligament, but pretty much all the transplantations come from a tendon. So you're taking a tendon, either in the hamstring or the patella, and splicing it into to function as a ligament in the to replace a torn ACL. So my point is, there's all kinds of surgeries and procedures that are done on a daily basis in the U.S. healthcare system that have to fall under a certain set of rules, and that rule set is written by the FDA. Guess what? Stem cell therapy is the same thing. It's an autotransplantation. And so the FDA has arbitrarily sort of changed the rules for autotransplantation around the other forms of cell therapy that can be done medically. So they've arbitrarily said, you can do bone marrow, but we don't want you doing fat, and we don't want you doing any other, we don't want you harvesting cells from any other source. Right? I don't know.
I'm like, I have two questions for you here.
No, I mean, it gets into there's very specific wording in the language, the regulatory language that exists for autotransplantation. And really what it says is, to try to break it down in the way I understand it, and I'm not an expert in this sort of the legalese, but I'm pretty well informed around this. Basically, there's verbiage that says you can, if you're harvesting an intended tissue, that tissue needs to be, the use needs to be autologous. And so the example is like blood vessel for blood vessel, right? So the example I used was coronary bypass graft. You're taking a vein, and a vein isn't identical to an artery, but it's pretty close. And it makes sense that you could see how you could use a vein for an artery. And so that's okay. But what the language says is, if you have to manipulate the tissue in a way that alters it from its original function, in a way that it would make a non-autologous use case, meaning if you're trying to take, I'm just going to come up with a wild example to make it obvious. If you're going to try to harvest tendon, and then you're going to try to do something to it, and then have it function as muscle, and splice it into a torn muscle or ripped muscle, that doesn't make sense. Like, tendon and ligament are so close, that makes sense medically. artery and vein are so close. Like you wouldn't take a vein and try to replace it for a tendon. Like that makes no sense.
Yeah, so it would be like
I don't know if
taking
this is
fat,
tracking,
like
but
you're
so there's,
taking the fat and you're making it a healing component.
yeah. And so basically they've said that there needs to be minimal manipulation of the tissue such that the tissue functions in the way that it naturally functioned in your body, and you're not altering that functionality. Okay.
Yeah.
So the legal, like this, the FDA's guidance on, you can do bone marrow, but you can't do any other tissue harvest for cell therapies, stem cell therapy, quote unquote stem cell therapy. They're basically breaking their own rule around, or maybe that's my opinion, right? So there are people who disagree with that. Or in my opinion, they don't understand the manipulation component, because what they've said is that the reason why mostly bone marrow is done here is people don't want to run afoul of the FDA. And then this gets into, well, who actually regulates the practice of medicine? The FDA doesn't regulate the practice of medicine. The state medical boards regulate the practice of medicine. So most doctors don't understand this. So if this is a lot for people listening, I don't want to go too deep in the weeds, but there's a reason why mostly bone marrow, like it's hard to find cell therapy that's not bone marrow derived here in the United States.
You can do that.
It's because people don't want to run afoul of the FDA guidance, even though the FDA guidance is arbitrary, makes absolutely no sense, and taking away the best cell therapies from people.
And that's why people end up going in
and this is why people think to get the best, because what I would argue is 15 years ago, to get the best cell therapy, it made sense to go abroad. Right now, it makes absolutely no sense to go abroad for stem cell therapy. And we'll kind of get into, so I'll get off the soapbox and the regulatory sort of structure, but the reality is the reason why it's bone marrow that's done here is because people don't, they don't want to stick their neck out, and they don't want to cross the FDA.
Yes.
And it's highly, the state medical boards who actually regulate whether doctors can, what we can do and how we can do it from a state level. We're fortunate in Colorado, the state medical board here understands cell therapy. It's been done here for a long time. They're open to it. You could go to a state, like I have clients who come from Virginia, Pennsylvania, a lot of the East Coast states, where the medical board is like, no way, there's no way we're going to allow this. Look what the FDA said, you can't do this here. So, that's why it's available in some states. So like California, Colorado, Utah, Nevada, we have more progressive medical boards. And so, I'm able to do sort of a wider range of cell therapies. But to get to your original question, bone marrow is good for young, healthy people.
Yeah.
And in my opinion, there are better forms of cell therapy. And there's some data behind that statement, but mostly that's been my experience.
Yeah.
And, we could get into like the numbers of stem cells available, but to branch back to the three things I was going to say.
I was going to bring that back. Yeah.
Bone marrow, harvest bone marrow, concentrate stem cells, put them where you need healing, right? Yeah. And the reality is the right term for those cells is a stromal cell. It's not really a stem cell, but we can get into that if you want to get into that later. The second form of cell therapy that I would talk about is where we do the same thing, but we use fat. So fat, we don't really want the fat. We want the stromal cells that live around the fat. And fat has a significantly higher number of those stem cells relative to many other tissues, including bone marrow. Some papers would show, 500x, meaning if you get 1 cc of bone marrow and 1 cc of fat, the fat should have 500, or some studies have shown 500x the number of those mesenchymal stromal cells relative to bone marrow. So in my opinion, like if I'm going to get, one cell from bone marrow and 500 of the cell that I'm looking for from fat, where am I going to, I'm going to get the 500 cells, not the one.
Yeah.
Fat is also less invasive. It's much easier to harvest, doesn't require sedation. Complication rates are exceedingly low. So Fat is a great source. You get a much higher number of stem cells. The processing is slightly different, but basically you harvest fat, concentrate the stromal cell, and then you deploy that stromal cell either as an injection or IV, depending on what tissue you're trying to heal.
Which is what me and Dave did with you.
Yeah.
That was the process.
And then the last thing, so that's what I did with you guys.
Yeah.
And even more specifically, what we did with you is the third thing that I was going to talk about is you take those cells, you harvest the cell that you're looking to use to heal, and then you can use culture and expansion and increasing the number of the cell to amplify the healing potential. So you could harvest bone marrow, concentrate the cell you're looking for, and then grow more of them in a petri dish, and then take those cells and deploy them for healing. But you can also do that from fat, and that's we did that with you. We harvest some fat, we bank that fat where we send it to a cell bank, where the cell bank in a GMP facility culture expands those cells, freezes them for you, and then you can then draw on those cells, whenever you need them, to deploy them either into a joint, a ligament, or intravenously to help heal tissue when you need help healing.
Yes.
So those are sort of the three things that I said I would cover. The one thing I'll cover is what's being done abroad, which is not autotransplantation, but it's actual transplantation, where you're harvesting a mesenchymal stem cell or a stromal cell, usually from placental tissue, which tend to be rich in these types of cells.
Yeah.
And you're culture expanding those, but giving them to somebody else.
Yeah.
Meaning like that's coming from a donated placenta, and you're giving it to a third party, meaning somebody where the cells didn't come from the placenta that they were delivered with, for lack of a better term.
Is there a danger for rejection when people do that?
So it's a great question, and this is where I think I get a little bit critical of some of the clinics that are well known abroad. I think a lot of these, there's some questions around immune interaction with cells from another person. Stem cells, what will be marketed is that stem cells are invisible or cloaked from the immune system. The reality is that the literature does show that they're cloaked, but they're not completely invisible, and you do get some form of cell and immune exposure.
Yeah.
What that implication is, if any, has been not clearly defined or delineated. Meaning, it would be very easy for some of these clinics to do like a 3-year, 5-year follow-up, because these clinics have been around for a long time. They've had a good number of people come to them. It would be easy to do like a 5-year follow-up study asking, have you been diagnosed with any cancer? Have you been diagnosed with any autoimmune disease? Have you had any unusual or medical diagnosis or hospitalization that seemed unusual or didn't make sense, and publish a 3 or 5 year or 10-year follow-up with a few hundred people or more in it, and it would answer a lot of these questions. But nobody's ever done that. So
I prefer not looking. Goodbye.
Well, I don't know, because the reality is I'm a proponent of the access to having these cells. Many people do this type of cell therapy, and it appears to be safe because we're not seeing like an epidemic of cancer in people who go to these clinics in Tijuana or Panama or Colombia or elsewhere. But the reality is we don't know. And so what the conversation I have with people is like, it seems like the risk is probably low, but we don't really know. And so your decision is, there might be some individual cases where it actually makes sense, where the best sort of cell therapy for you is to use somebody else's cell. But in general, broadly speaking, we have way more literature. We have way more long-term follow-up on cancer rates, the non-development of these other sort of risks or considerations that people think about. And in general, the safest thing for you, and this is true with any sort of transplantation, is the safest thing for you is your own cells. And so when people hear that, most people, and for most scenarios, choose to use their own. But it is an option, and so that's why I bring it up. And again, in the right scenario, it might be the right sort of thing to do. But I think the problem is people think it's the only way to do it, and that's absolutely not the case.
Yeah.
So that's why I appreciate you asking. So
that's a fair answer.
Very broad strokes, like what people are talking about when they talk about stem cell therapy is some version of bone marrow fat, cultured product, or placental derived product. That's what people are hearing about.
Yeah. And then from those, like, what are the main application of that? That's an example. I know me and Dave, when we came to you, was like mostly orthopedic, right? I had a surgery on my right shoulder, and I was like, I do not want to get one on my left, but I know maybe, that's coming for me, and like my knees and my lower back. And by the way, they all feel great now. But that was like, I know for me and Dave, that was like the main thing is like, we do not want to get under like the scalpel under a surgery. And that's why we came to you to do that. Is there like other application, like more in the realm of like autoimmune disease, like anything that kind of comes with like inflammation in the body? Like, what is the range of application of this, so people can be like, I fall with it in this bucket or this bucket or this bucket?
Right. So for most cases, the way this therapy was started, it was not invented here in the United States. It was really pioneered in France and in Korea. It was initially used for musculoskeletal problems, cartilage issues, ligament tears, vertebral discs in the neck and the low back. So think about like things that if go too far will require some form of replacement surgery, either like in the form of knee replacement or disc replacement or ligament replacement, like like a ligament transplant or tendon transplant. The reality is the reason why we as humans don't heal those problems, let's take cartilage for example, is that these stem cells or these stromal cells work in regionally, meaning the stem cells that live around your knee tend to stick around your knee. It's possible for a stem cell in your knee to move to your brain or to your foot, but in general, they tend to stay regional. And so in your high wear areas, the areas where you put a lot of wear and tear over your life, you're chewing through that local resource faster relative to the lower wear and tear areas of your body. And so for like the typical high wear areas are like knees, shoulders, low back.
Yeah.
These are just like as humans, our vulnerable points, the things that we're doing, we're putting a lot of stress on those joints. And the stem cells, they're working, from the time you're born to the time you die, they're working to try to heal things. And we tend to hit sort of a point, a threshold where that local reservoir of cells has been chewed thin because they're not immortal. They have a life, they have a certain amount of healing capacity that they can, use to help heal the tissue that they're in contact with. But eventually you wear through that healing ability. And it's when we hit our late 30s, 40s, 50s, when we start to see the wear and tear overtake the healing ability. So all we're doing is we're sort of topping up the well of healing ability in these regional buckets, like your shoulders, your knees, your low back, or elsewhere. When we do this transplantation, we're just pulling cells from somewhere else that are laying relatively dormant and putting them into an area where your body needs help healing. So most people are used to thinking about these therapies, and most physicians indeed are only trained in using these therapies for musculoskeletal issues and chronic degenerative musculoskeletal issues. And the reality is these are cells that are present in every tissue of your body. They're present in your brain, your heart, your lung, your spleen, your liver, your muscle. They're present in higher numbers in highly vascular tissues, so tissues that have good blood supply, because they live on the blood vessels. So where you have a lot of blood vessels, you have a lot of stem cells. You have a lot of stromal cells. And the reality is, and this is where if somebody wanted to come down on me, so I have to be clear, this is my opinion. And there is a small amount of literature to support this, but not a large, robust amount of literature to support the statement. So this is my opinion, but in my opinion, you can heal almost any tissue in the body with these cells because it's how those tissues naturally heal in the first place. The problem that people run into and the problem that doctors run into is they often come late in the tissue injury process. So great example, and this is just an example in my opinion, but dementia, for example. So a lot of people are like, man, I've got my grandmother developed Parkinson's disease. Can I use stem cells to fix that? Well, in my opinion, and this starts branching into the kind of medicine that I practice versus the way the traditional system approaches medicine. If you started early enough in a preventative fashion, deploying, stem cells on a regular basis to heal tissue like brain early in the process, one could conceive that it is possible to either delay or, in the best case scenario, potentially avert, the end stage of whatever the early degenerative process. So the current limitations of these cells, if you have full-blown dementia or Parkinson's, getting an IV infusion or an intrathecal deployment, meaning like an injection of stem cells into the brain space, is not going to cure that disease process. Yeah. But if we change our paradigm in the way of thinking, and let's take dementia, for example, that's a slowly developing chronic degenerative process that starts decades before it's even, years before it's symptomatic and decades usually before it's actually diagnosed.
Yeah.
Is there a way to use stem cells early in the process to prevent the decay and decline? I believe that is possible. I don't have hard data. There are no big studies. This is just my belief. But the point is, these stem cells do help heal tissue. They can help heal almost any tissue in the body. And a lot of the details around how to use them, where to use them, the best way to use them, we don't have those answers yet because a lot of that research has not been done.
Yeah, I'm so glad you brought like the brain and the heart on, because I feel like even in my head, you forget that those are also tissue. Like everything is so like bicep and this, and it's like, well, your brain is also a muscle.
Well, your brain's tissue that, gets, so we think of injury as like, oh, you tore something. Trauma. But aging, what is aging? And this branches into, sort of like the broader practice of medicine now, at least what I believe the broader practice of medicine should be, is aging is really a chronic degenerative process. We slowly over time accumulate damage, whether that's in the form of like oxidative damage from inflammation, or wear and tear damage just from mechanical wear and tear, or toxic exposure from UV light or mercury or lead or the plastics we're all breathing and drinking. Whatever the toxin creates an injury, and slowly over time that accumulates, and that's what gradually ages us, for lack of a better term. And so aging could be thought of, one way to think about it is a chronic degenerative injury process.
And like of being able to heal it.
Yes.
Because we're going to be exposed, right?
We're all getting damaged. I mean, and so this starts to bridge us into sort of a different form of medicine. But what I found early on with stem cell therapy, with stromal therapies, is that healthy people get really good results. People who are metabolic disasters, meaning like they're overweight, they're diabetic, they're on 7 different medications, they're, often they're older. They don't get good outcomes. And why? And this confuses a lot of doctors, because doctors, they're looking for a tool that they can just sort of like, oh, you have knee degeneration. Like, I'm looking for a tool to fix knee degeneration. Guess what? If you're 60 and you're healthy and you have chronic cartilage degeneration in your knee, you're more likely to get a better result out of a cell therapy.
Yeah.
Someone who's same age, with the same amount of degeneration, but has, diabetes, in the medical terms is a metabolic mess.
Yeah, that makes
Because
sense to
if
me
I
though.
take your natural healing ability from you,
Hmm.
guess what? Those metabolic hindrances are impacting that healing cell.
Yes, they're
And
all
so you can
information.
expect compromised function from that cell
Mm.
when it's deployed locally. And so this is where traditional medicine doesn't understand these therapies at all. And they're like, no, it doesn't work, because I've had a patient who had a stem cell injection, and they're on 6
Yeah.
medications, 3 of which we know poison stem cell function and are terrible for mitochondrial function. All of it inhibits your natural healing ability. And so we're concentrating your natural healing ability and trying to put it in a place and expecting it to do more than it's capable of doing. So where am I going with this? If you health optimize that person, if you take that metabolic disaster and you say, hey, listen, are you willing to put in 6, 9, 12 months of investment in your health, clean up your diet, start losing weight? And, even some people who aren't significantly overweight, but let's clean up your metabolic issues.
Mhm.
We take care, we cure the diabetes, because type 2 diabetes is totally curable.
Mhm.
And guess what? Now we can eliminate 1, 2, maybe 3 medications. We fix your blood pressure. We fix your cholesterol. Many of those medications which poison mitochondrial function, which significantly affect stem cell function. Now you've pulled all those inhibitors out of the way. Now you can actually do a cell procedure on somebody and get good results, because you've improved their natural healing ability.
Yeah.
And so where my practice naturally went, you're right, it started really as like stem cells, because I learned about stem cells from guys at the jiu-jitsu gym. And they were asking me, I started there and they were like, you're a doctor, we want to do stem cell therapy, but we don't know who to trust. We want you to do it. We trust you.
Mm.
I was like, I don't know what you're talking, that doesn't exist. And they would give me these funny looks, when I first started training, because they're all listening to Rogan. They knew about this. I was in the system, I didn't.
That's
And
funny.
after a while, I started, I took a look at it. I went to a conference and I was wholly expecting a bunch of horse hockey,
Blown away.
a bunch of, professors from Case Western Reserve, UCLA, USC, these bow tie academic professors presenting their research. And I remember I was sitting in that conference and I was thinking, this is amazing what they're showing me. I can't believe, how did I never hear about this in the medical community?
Right.
At the gym.
Wow.
And
I
so,
mean, that right there is it is kind of crazy, because I feel like I've heard about stem cell like such a long time ago, because all the athletes were getting hurt, and everyone talks, and it's like I don't even remember where it came from, but the fact that athletes would hear about it before people in the profession, it just says so much. It just says so much about the system.
To this day, people don't. You go ask a doctor, this is highly likely the response you're going to get. There's no evidence that it works. There's not enough research.
Yeah.
We have a problem in medicine in that doctors have a problem saying, I don't know.
Mm.
They have a problem saying, I don't know. They want to have the answers for you. I think it comes from a good place.
Yeah.
But what ends up happening is they think, if this were a good therapy, I would have heard about it at my annual conference, at my, but the problem is, at a lot of these orthopedic and sports medicine conferences, they want to do this wide, blind, we want a huge, a study where we have a cross section of the population and we assess whether the therapy is effective or not. But for the reasons I just explained to you, you can't take cell therapy and apply it to a cross section of the American population and expect good results, because those people are sick.
Exactly. They're filled with inflammation.
Disasters.
Yes.
And so you cannot expect their healing capacity to function optimally and get them good outcomes unless You health optimize them.
Yeah.
Do the work. And this is where, this is where people are now. It's like, it's the fundamentals. It's diet, it's nutrition, it's, believe it or not, it's grounding, purpose, being spiritually healthy.
Yeah. Yes.
That's more important than any medical therapy. The longevity data on this is so clear. If you are healthy in your mind, your body, and your spirit, and you are happy and have gratitude and pour that energy into the world, guess what you're going to get back? That's what you're going to get back. You're going to be healthier, happier, and your outcomes are going to be better. Nobody can argue that. That's not my opinion. That's hard science.
Yeah.
That demonstrated that now. We have the data. So anyway, sorry, I'm getting on my soapbox, but if you want good outcomes,
I love the soapbox. I'm all in for the grounding.
You have to start with yourself, your mindset, how you look at what you do, how you look at your injuries, how you treat your body. Are you treating your body well?
Yeah.
Are you doom scrolling at 3 a.m? Or are you going to bed at a regular time and waking up at a regular time because that's what your body, that's what you need.
Yeah.
To be healthy, to be happy. Now, I'm not saying there isn't place for therapeutics and supplements and peptides and all these other things, because I believe there is.
But they go together with that. It's like enhance.
You can't just take a cell and do a stem cell therapy and apply it to an unhealthy population and say, see, the therapy sucks, it doesn't work.
Yeah. Meanwhile, they're ingesting
every one of those studies
poison.
is looking at diseased people.
Yeah.
And our system is so warped in how it views health that it doesn't even recognize that.
Oh, yeah.
So,
we just had a discussion with the Oliver Trainer friend the other day, and it's being promoted now that a 20-minute walk is a workout. And it's like I just don't even know where to start, because it's such a, like, everyone should be able to move. Like, that is not even like, that's like a foundational. We're not even like, and same thing with food. The amount of people I work with that are grown-up adult, and I'm like, hey, let's start by eating 3 real meal a day. We're not snacking all day, right? We're not like drinking a coffee for breakfast. We're like 3 real meal a day with like real food. And it's like, it's mind-blowing how little they're doing this.
And people get shocked, so I have so many, clients where, they came in looking for the quick fix, looking for the symptoms, because they were miserable.
Yes.
They're in pain, failed back surgeries, in fact, like miserable, addicted to opiates, like you name it, just suicidal, they will tell you if you ask them, like, I was so bad, I didn't know where to go and what to do, and I felt so hopeless. I was like, I don't want to live like this.
Yeah.
And then you take that person, you get them focused on, okay, I'm going to take a different trajectory in my health. You address the fundamentals, you peel back the poison that they're on. And when I say poison, I want to be clear, like, if anybody hops on my Instagram, they're going to see I like harp on Big Pharma all the time. I appreciate Big Pharma for what it does, but you can't look to Big Pharma and you can't look to industrialized medicine to fix the foundational things that you need to take responsibility for. They are not going to fix them for you. Right?
Yeah.
And so many of those medicines are poison. Many of those medicines you do not need. And if you do the foundational work, you can get off of them. Antidepressants, blood pressure, diabetes. Are you hearing something, or?
Yeah, the boys in the kitchen.
I just want to make sure I didn't have like something playing here.
No.
But anyway, so my point being, take care of the foundational components. And don't rely on pharma where you can actually address that from a root cause perspective.
Yeah.
You do then you can take that person, do a cell therapy on them, and get miraculous results.
Yeah.
Cure them from multiple chronic diseases that the system is, you're going to have this for your life.
Yeah.
And most of that is not like a stem cell therapy. That's you do the foundational work. Now your healing capacity is good. Now you can rely on your healing capacity to get you over these burdens and hurdles that have been destroying your life. It's totally possible.
What do you think would be like, I mean, in your practice, like kind of those foundational things that you're talking about, like what would you say are like the top 5 things that you see, like to try to keep that? Because I feel like for a lot of people, they'll hear me and you say things like that, right? Well, take your nutrition over, it's so good, and exercise, and they're sitting and they're like, what does that mean? Like, what is the least amount of change that I can put into my life that I will get the most out of?
So I think great question. I think I'm going to give you 2 different answers to that, because I guess there's multiple different ways to approach it depending on how involved you want to be and what your resources are. In an ideal world, you would come to a place like me, where we do a head to toe diagnostic, evaluation on you, all the biomarkers, gut microbiome, all the advanced imaging, a full strength and mobility assessment from a doctor of physical therapy who knows and understands how the body moves and where the stress points are. A tissue and fascial tissue assessment. You then take all that data, because we can tell you from the genetics and from the advanced biomarkers, what is your ideal diet based on the current level of knowledge and diagnostics that we have. It's very clear. We can tell you should steer towards these foods and steer away from these other foods. These foods are driving a lot of inflammation in your system, and it's better for you to look at these alternatives from both a genetic and an immune diagnostic perspective. So in an ideal world, you could actually have a complete playbook laid out for you based on scientifically validated diagnostic studies that can be done to tell you exactly how you should be eating, what the best foods are, and what the best sort of exercise is for your longevity. That's pretty involved, right?
Yeah, that's pretty amazing too, because I feel like it's that.
That's what I'm doing now. So we do a lot of cell therapy. We use a lot of biologics like peptides, but it's, I have a nutritionist, I have a strength and mobility, we have specialists. We round on our team monthly. Our team rounds monthly on all our clients. So often, I learn all kinds of stuff from the nutritionist and from, our strength and mobility people, because when somebody's working out, they talk to the trainer they're with.
Yeah.
And sometimes it's not the same, you know what I mean? They're not in the same frame of mind, but we get information that's really pertinent for their health and for implementing a long-term longevity plan. So it takes a team approach. So that's one way to do it. That's more involved. Another way to do it is, I love what you said, which is eat real food. What is real food? If you put it in a cupboard and it's not molding or rotten in a week or 10 days, it's not real food.
Yeah.
And there are some exceptions to that, dried fruit and nuts, those will, but use your head. We're all intelligent. You know what real food is. And if you're not sure, stick it somewhere for a week. And if it's not rotten, it's not rotten.
Yeah.
Eat real food. Move your body. Move your body somewhere between 3 and 5 hours a week. Okay.
And when you say that, are you saying just walking, or does it need to be intense, unintense, some weight, some no weight?
The reality is we could get really, really granular on this, but to try to keep it simple, you should be doing some form of aerobic exercise that's driving your heart rate up for a portion of those 3 to 5. And I would say 3 hours is the minimum, right? The minimum. But for some people, if 3 hours seems like a huge hurdle, start with trying to get 3 hours of exercise a week. Some of that should be aerobic, and some of that should be strength.
Mhm.
That could be
Yeah.
body weight exercise, it could be bands, it doesn't have to be free weights, but some form of a combination of aerobic exercise and something to enhance your strength.
Yeah, some resistance training and some bring the heart rate up.
Yep.
Yeah.
So real food, 3 to 5 hours of exercise split between aerobic, getting your heart rate up, and strength, working the muscles. And then you have to have, in my opinion, for true health, some form of self-introspective activity where rest and recovery, gratitude, empathy, forgiveness, compassion are focal points in that practice. And whether it's journaling, whether it's going to a faith-based service, whether it's meditating, in my opinion, and I would argue the science would show it's non-denominational how you do that. But what's key and what's important is understanding that we are all a part of something bigger than ourselves.
Mm-hmm.
And understanding that the more love, gratitude, empathy, compassion, forgiveness that we can pour into the world, the better it's going to be for ourselves and everybody else. And if you start there, you're on the track to a longer, healthier life. So,
I could not agree more. I see so many of our clients just checking the box, of fitness and training, and it comes, I think, for a lot of people with almost shame and guilt of like, I'm ashamed because I ate not good, or like I feel guilty for not doing the right thing, and it's like, let's flip that around,
yeah.
like completely. My God, look at what my body can do. Like, look at how much I can nourish and strengthen myself rather than this like punishing. And then you start changing how you see yourself. And yeah, we put such a big burden on ourselves. And I do think that caused tremendous stress and autoimmune disease in us for sure.
So, this is where, I left the farm long time ago. And when I say from traditional medicine, right, like I sold my practice, like I left. Everybody said I was crazy. They're like, you're going to go practice, like do preventative, like cell therapy, like cash bait, like insurance doesn't pay for any of this. Like you're insane. Right. That was, 10 plus ish years ago. Best thing I ever did. Because, for a number of different reasons, but traditional medicine does not approach health from this mindset.
Yes.
And it's toxic to the providers, and it's toxic to the people in the system. And I'm a proponent of the system, right? In that we're good at what we're good at in the system. You get shot, you get hit by a truck, you have a heart attack, you have a stroke. Like you're suffering the catastrophe. We're fantastic at that. We do that better than anyone in the world. Yeah. Run, don't walk to your nearest emergency room, hospital, clinic. It's highly likely you will get fantastic care. But if you want to take control of your health and you want to lay out a plan to keep you healthy and minimize the risk of you getting one of those catastrophes or one of those things happening to you, the system is the last place you're going to get that.
Yeah.
So, there's, and I think bringing it back to, we didn't even get to fasting. I'm sorry. I know you were.
It's okay. I think we'll do it next time because this is so good that, it doesn't matter.
Yeah. Like we didn't get to fasting. We didn't get to peptides. There's
so much.
There's so
let's
much.
do episode 2 and 3 will be those,
Sure.
But I would much prefer have like a just good in-depth conversation about one at a time. Yeah. So like people can sit like me right now and be like, yes, okay.
Yeah, but I think when you speak this, because I know you're doing the same thing with your clients.
Yes, there's so much that are like this, and I had a girl, and I like I call my clients all the time. I'm like, you've been with us forever. Please jump on a call. Like the connection is so important for me and Dave because we truly care and love. Um, and she, we had this call and she's been with us for 6 years and her body has changed tremendously. And I'm so excited for her. And I see all her beauty right coming in. And I asked her, I was like, so how has it been? Like, wow, like, and she was like, well, I can't see it. And it just like broke my heart because I was like, oh my God, you're like stuck here. Like you're stuck in your head and you can't see your own beauty. So like right now, me and you are like we're chasing something completely different because I see you flourishing on the outside, but if the inside doesn't match up, I'm like, it doesn't matter what body
Yeah.
we're in, you
Yeah.
will never see it.
Yes.
And it was like, yeah, I'm like, there's just so many people like that, and it's like
Well, yeah.
it's just hard, like, and me and Dave are so much now starting to really go on the other side where we're doing so much more things with like kind of that self-acceptance because
Yeah.
that drives everything and it makes you either stop chasing or have the right kind of chase, which
Yeah.
I feel, which is like nourishing and strengthening your body. And you will wear your work. And that is a whole different way of seeing yourself than like chasing. I have to look like this so I can be enough and I can accept myself. And it's like, well, you're not, I'm sorry, but I don't think you'll accept yourself here because it's still with,
Yeah.
outside approval. So I think it is a really hard, it's a really hard thing to work on with a lot of my female clients, that self-acceptance. And it's like, I believe so much in you and I just need you to feel one spark of me. So hopefully it can unravel for you.
Yeah. Well, the work, I mean, I think there's, a lot of people would say, well, there's no hack there, right? And I would disagree with them
I
because the
do,
psychedelics,
I do too.
used properly, right? Like these are,
Yeah.
and I say this, I know we're getting close to the end, but um, these are not things to be, in my opinion, um, this should be treated like a sacrament.
Yes.
This
Yes.
is this is a gift from God, from Mother Earth. Like
Yeah.
this is where I say I'm non-denominational around this. Wherever that gift is coming from, it's a gift, and we have to, in my opinion, to do it properly, it needs to be done responsibly.
Oh, I couldn't agree more with you. To me, that is not a party thing. It is a ritual, holistic, healing, divine, and it has to be done with so much respect and like, yes, like
And
really like going in with the right people around you, the right person holding space, so you can really get through the experience in this like just divine, positive environment.
and you have to be ready for it. And I think a lot of
Yes.
people, like, where what I hear you saying is, because I see this too, some people aren't ready, and
Yeah.
that's okay. But if you can do the kind of work that you're doing, like if you can start looking at yourself,
Mm.
start being honest with yourself, start loving yourself. Like, what is that most like? And I'll be honest, like sometimes I don't even know what that means, right?
Yes.
So like, how do we get success? You drive, right? Like we burn the candle at both ends. We're our system, right? And so it's so deceiving because it's like, well, isn't that what I should be doing? Well,
It's
maybe
oh,
to a degree, right?
yeah.
In the right way, but it has to be balanced. And so I think this is where we're running up against, like, a lot of people don't get that there's this other sort of side
Yeah.
that we need to sort of nurture. Anyway, and so
No,
yeah, I
it
think
is
it's
very
fantastic
tricky.
that you're
It
doing
is
that with
very,
people. Sorry, what was
yeah,
that?
it's just tricky. I agree with you because I feel like that push pull in my life a lot because me and Dave will talk and I'm like, I literally want to do everything for free, but also I need money for a haircut.
Yeah.
So it's like, and if you do everything for free, then you also invite like, psychopaths and a lot of
You-
people that are just going to want to come burn down the place. So
And you
it
are
is
worth,
tricky.
Camille, like you are so, look at what you bring to the world. You're so amazing.
Thank you.
Well, you are. I mean, and Dave and your entire
Yeah.
family.
Yeah, what's up, dude?
That's worth something.
Good.
Yeah.
Good. How are you doing?
We're working on that.
You're worth, like you're more than worth it, And so
Yeah.
like
Thank
I'm
you.
saying this to myself at the same, like I struggle with the same things,
Mhm.
but this is
Yeah.
what I mean. It's a tricky, like how, like self-love, like how is that expressed? Well, it's how do you value your
Yes.
time, right?
Yes.
And that's an evolution. It's not, like it's a process. So
Yeah.
Awesome, dude.
it's
I get it.
lots of levels.
Yeah, and the level never stop either. But yeah, I mean, you're the one who introduced me to the full-on plant medicine journey, and I've been on it for a long time now. Since then, like literally, and Dave full-on too has become as spiritual as me, if not more.
Yeah.
But it's just a nice way to be able to face yourself with love and compassion. And I think that's the biggest thing for me coming from that, because I'll feel resistance in myself. And the voice starts chattering, and it's like now you're shaming yourself for shaming yourself, because you're like, I shouldn't shame myself. And like now and I'm like, whoa, whoa, whoa. So it's like, okay, like how can I meet myself here with love and compassion and see it for what it is? And it's just so helpful.
I love it.
It's so good. All right. Thank you so much.
Yeah, thank you. Really
You're
appreciate
great.
you inviting me on.
And can you just let everyone know where they can find you, either if they want to ask you a question or find
Sure.
your office, and
Yeah,
if
I
they're
guess,
interested in working with you.
Yeah, thank you. So longevityhealth.clinic. So longevityhealth.clinic. Dr. Vassily on Instagram.
And when you do it doesn't have to be like nothing at all, right?
It's probably more than
bone
enough.
broth and salt.
Perfect. And for anyone listening, let us know whatever you would want Dr. Vassily to talk about, whether it's like, peptide, fasting, whatever, Ozempic, like whatever trend is happening right now. Yeah, great resource here. So let's use it.
Yeah, be happy to do it.
Thank you.
Awesome. Anytime, Camille. Thank you so much.